blood cultures. This is a type of special collection. Normally, if you see an order, it will say blood cultures. If you work in a hospital setting, it'll say blood cultures ×2. You'll explain why. You will learn why in just a moment when I explain. But there's some key things to know and understand about blood cultures. You need to know and understand that the purpose of blood cultures is to help determine whether or not a person has a systemic infection. A systemic infection is an infection throughout their entire body. This is ordered when a patient is suspected to have had a bacterial or a fungal infection in their bloodstream. And sometimes there's localized infections, and then there is systemic infections. A localized infection is just like maybe, you got a paper cut or a bug bite, and then it started to get infected. It gets red, warm, pussy. That is a localized infection. Once it makes its way to the bloodstream, then that becomes more of a systemic infection. In this situation, the doctor or the provider will be ordering blood cultures. And typically these patients are very, very sick, and they're going to be in the hospital setting. When you are doing a blood culture, you will need one bottle, which is an aerobic bottle, and another bottle, which is an anaerobic bottle. So there's two bottles, and you're going to see a video. There's a video in here that I want you to watch that explains to you how the blood cultures are drawn. It is very different from any other type of blood draw. Very different. Blood cultures are the first draw. So you know how we taught your brother Robert gives lovely gifts, right? It's understood that blood cultures go before your brother for yellow. So with blood cultures, the whole purpose of having the aerobic versus the anaerobic is that the aerobic, it encourages growth of microorganisms that require oxygen. And then anaerobic is for microorganisms that do not require oxygen to grow. Typically, when you draw blood cultures, you're going to send them to the lab. The lab is going to incubate them in it's like a warm refrigerator. And they usually incubate them for anywhere from 24 to 72 hours. By the time they pull them out every day starting at hour 24 to see if there's any bacterial growth. Now, when you see the video, blood cultures are in a huge bottle, and there's a broth inside of the bottle, and that broth encourages growth of organisms. All right, next slide. When you draw blood for a blood culture, you're going to always use the winged collection set, also known as the butterfly set. And this prevents the broth from entering the patient's blood, right? It prevents backflow, because when you see the bottle, you'll understand what I'm saying. It allows the bottle to be kept upright so that it can fill, and it allows the phlebotomy technician to see how full the bottle is. The bottle already has maybe about 10 milliliters of fluid in it, and you have to put another 10 milliliters of blood in it. So you'll notice when you see the video, there are little lines on the blood culture bottle, and they usually mark for every 5 mLs. So there's an additional 10. So when you draw blood cultures, and this is a test question, when you draw blood cultures, there has to be 20 mLs of blood, 10 in one bottle, 10 in the other. It's very, very important that when you clean the site, you're cleaning the site more thoroughly than you would clean. Usually this involves initial cleaning with 70% isopropyl alcohol for 60 seconds. And then after it dries, you follow up with another 60 seconds scrub of chlorhexidine gluconate. So it's usually about a 2-minute prep time, or whatever your facility states. Remember that the antiseptic must be completely dried before you start the puncture. This helps prevent any type of contamination, okay, or a false positive. Also, cleaning the site is so important. If you do not clean the site correctly, we all have bacteria. You got bacteria on your skin. I have bacteria on my skin. If we don't scrub and clean the skin well enough, as soon as that needle goes in, it's going to pull the bacteria from the skin and then pull it down into the bottle. And what's going to happen is when they start incubating it, it's going to look like you have an infection in your blood when really it was just the organism on your skin. Or it'll grow 2 different organisms if you do have an organism in your blood. one in your blood and one from your skin, and they won't know which one they're supposed to treat. Every microorganism is treated differently or killed differently. All right, next slide. There are some more adjustments you need to make or think about when you're doing blood cultures. Oh, also, I want to say this too real quick. I mentioned that you're supposed to clean the site really good. You're also supposed to clean the top of the blood culture bottles. There's like a little piece of an aluminum that you pop off and you scrub the top of the blood culture bottle also. But anyway, so again, each facility is going to have their own policy, and there's even manufacturing instructions for these tubes. Some blood culture bottles may fill directly. There might be like an evacuated tube. It's a larger it's a larger holder, and it'll go over the evacuated tube. Some may even require that you use a syringe to actually transfer it. So I've seen both. I think in the video, I'm going to show you they actually do not use the syringe method. They use the giant holder method, but there is a syringe method also. I'll find a video that has like just a syringe method in general, and I'll put it in here for you. But just know that you have to avoid any unnecessary transfers, because every time you transfer, for instance, you put in a syringe and then you take it from the syringe and you put it in the bottle, each transfer increases the chance of contaminating the specimen. So you want to try to not do that if you can help it. There are rubber stoppers. As I mentioned, you're going to clean them and allow them to completely dry before you start the draw. All right. This is muy importante. You need to know this. Fill the aerobic bottle first, and then the anaerobic bottle second. This avoids introducing air from the butterfly tubing into the anaerobic bottle. Remember, the aerobic bottle, it's okay to get oxygen in there. We want oxygen in there because in that bottle, I want to see if organisms who require oxygen will grow. And the line for the butterfly tubing, there's oxygen in there. So it's going to dump the oxygen and then the blood into that bottle. That's cool. That's okay. The second bottle, which is the anaerobic bottle, there's already blood in the tube, and there's not going to be any oxygen dumped in there. And we want no oxygen in there because we want to see if the organism will grow without oxygen. So it's very important that you always fill the aerobic bottle first and the anaerobic bottle second. Now, some people say, oh, it's the maroon first and the blue second. You cannot go by color. Every company has a different color that they make their blood culture bottles. So you just have to read the blood culture bottle and it will tell you on it. Also, if the order says so, you always collect 2 sets of blood cultures from 2 different sites. That's important. One blood culture from this site, the second blood culture from another site. The reason why you would pull 2 different blood cultures is just in case I made a mistake on one of them. So if I accidentally contaminated the first one, the second one will prove if I contaminated or if the person really does have 2 different organisms in their blood. I'm going to tell you this now. That's a lot of blood. That's like 40 mLs of blood. So get it right the first time. Collecting blood cultures would be first, as I mentioned, and then you would do any other order of draw. The order of draw comes after that. So your brother Robert gives lovely gifts. You would do the order after that, but blood cultures come first. So that's it for that. I'm going to go ahead and stop here, and I want you to watch the video. I want you to see how blood cultures are actually drawn. I want you to see like how sterile they try to make the process. There's gowns involved. There's a lot. So go ahead and watch this video, and I'll see you in the next lecture.